we're moving to the next discussion, and this discussion now is talking about the second trimester of pregnancy. So for countries that abortion is legal, okay, if a woman comes to me for abortion and she is in the second trimester of pregnancy, what are the medical methods I can use? What are the surgical methods I can use to be able to do this abortion in a very safe way? Okay, so medical and surgical methods, okay, to be used for abortions in the second trimester. Okay, so second trimester, you should know that second trimester is from what, week 13 to 24 weeks. Okay, so that's like outside the first 3 months. So abortions can be safely performed using medical and surgical methods. So these are the medical and surgical methods we'll be seeing for this second trimester. So for second trimester, you have to, unlike the first trimester that you just dose misoprostol at least once, for the second trimester you have to repeatedly dose the misoprostol. You combine it with mifepristone. So the misoprostol is what will actually induce all those uterine contractions, and mifepristone will stop the production of progesterone, which is needed to sustain the pregnancy. Okay, and it's typically performed between week 13 to 20, but you can also do it up to week 24. So of course, for this one, you do it in a clinical setting. May take several hours to few days. Requires monitoring. Okay, so you have to follow up the patient, and you have to actually ensure that the patient is following up with their dose and everything. So recovery, you can have bleeding and cramping, maybe intense. Okay, advantages is non-surgical, you know. Do you understand? And well, the disadvantages actually causes a lot of bleedings. It could lead to incomplete abortions and the rest of it. Surgical methods for abortion. For the second trimester, the surgical method which is basically advised is the dilation and evacuation. That's the D and E. It's the most common surgical technique for the second trimester. Okay, so it's usually performed between week 15 to 23. So you have to you have to prepare the cervix. Okay, it's performed by a trained provider using suction and surgical instruments. So it's typically completed in 1 or 2 days, depending on the gestational age. Effective, 99% is actually effective. Okay, so recovery, there's a shorter recovery time than the medical abortion. There's light bleeding and cramping. The bleeding and cramping is not really that much, you know. So advantage is highly effective. There's less bleeding, you know, and of course once you complete the abortion, you can just